Good afternoon. This afternoon, I'd like to share with you a few more views on the healthcare legislation. Yesterday, right here in my hometown of Grants Pass, Oregon, Senator Ron Wyden held a town hall. At that meeting, he was asked a question which many Americans throughout the country have been asking. What in the Constitution of the United States authorizes Congress to pass healthcare legislation? Legislation that would require every American to have health insurance and impose penalties on them if they don't comply. Senator Wyden's answer was the General Welfare Clause. I beg to disagree. First, general welfare is referred to in the Preamble to the Constitution. The Preamble is an introductory statement. It does not enumerate powers granted to either the executive or legislative branches of government. As such, the Preamble does not actually have the effect of law. It's like an introductory statement to a business plan or procedures for any organization, which sets out a general idea of why those procedures are being written, but in itself does not impose rules or requirements. Secondly, there's a very big misunderstanding and misinterpretation of what the Preamble actually states. The words in the Preamble are promote the general welfare, not provide for the general welfare. There's a big difference. To provide for would be to give, to hand to the people the means for them to have a good life or happiness or well-being. Promote means an entirely different thing. It means to establish a climate that allows people to pursue themselves freely enterprises which make for well-being for themselves, their families, and their communities. In fact, it's the total opposite of providing for, giving something to people. It's rather appalling that our congressmen and senators and most of the media so blatantly misunderstand or deliberately misconstrue our United States Constitution. Also during the town hall meeting, Senator Ron Wyden discussed his proposal as an alternative to the healthcare legislation currently before the Senate. Senator Wyden's plan would offer to each American the same kind of health care enjoyed by members of Congress. Now, quite true, this would be a lot better plan than what's currently on the floor. However, personally, I'm also opposed to that plan. First and foremost, our government, meaning we, the tax-paying citizens, simply don't have the money to pay for it. It would impose, as does the current proposal, billions, no, probably trillions of dollars additional to our national deficit. We all know the Treasury cannot simply keep printing money worth less and less to cover that deficit. So, actually, what I'm saying is, from a fiscal point of view, fiscal responsibility, no plan of giving another entitlement program is justified. Furthermore, any plan would impose more controls and restrictions on all of us. It would take away our choices to decide what kind of insurance we want to buy, if we want to buy insurance, to choose what doctors we want to see, what hospitals, what procedures we want done. So I'm saying, 1, Senator Wyden and others like you, don't tell me that our Constitution justifies this entitlement program and the new controls it would impose. 2, thanks but no thanks. I don't want a health care plan that would obligate me and future generations to a tax burden that's unimaginable. I'd like to ask you all to join with me in telling our senators, your representatives, thanks but no thanks. Write to them, email them, telephone, fax, continue our fight against this monstrosity of a health care bill. Write to the media, write to your local newspapers. Please join me in this effort. I thank you for listening, and good afternoon.